Hi, I am Dr. Nikhil Agrawal. I am Director of GI Oncosurgery at Max Super Speciality Hospital, Saket in New Delhi. Good outcome of treatment in rectal cancer depends on early diagnosis and appropriate treatment. Let's understand how we treat rectal cancer. So, treatment of rectal cancer depends on stage of tumor, location of tumor, and its relationship to the anal sphincter. If we find rectal cancer in a very early stage or early stage in the upper part of rectum, then we can directly operate these patients. But most of our patients will require radiation and sometimes chemotherapy before surgery and after surgery. Some patients have a special mutation which is called as MSI or MMR, and these patients are treated with immunotherapy in addition to surgery. Sequences is one of the important things in the treatment of rectal cancer. When it comes to surgical procedure, there are various surgical procedures. Very small tumors can be removed locally, where we go from the anal canal, we reach the rectum and we remove the tumor. This is called as transanal local excision. Or we do procedures like anterior resection or low anterior resection. In this, the part of the rectum having the tumor is removed along with all the fat and adjacent lymph nodes. There's a technical term for this, we called it TME, and then we join back the cut end of the intestine to restore intestinal continuity. Sometimes the tumor is very close to the anal canal. These tumors are treated with a surgery which is called as intersphincteric resection. In this, we also remove part of inner layer of sphincter to completely clear the tumor and then join back the intestine. In some patients, when sphincter is involved with tumor, we can't save the sphincter. Then we do a surgery which is called as abdominoperineal resection, and we have to create a permanent stoma on the abdomen of the patient. These surgeries earlier used to be done with an open technique. Now we do these surgeries with minimally invasive techniques which are robotic and laparoscopic. In this, we make small holes in the abdomen instead of a long incision, and this gives you faster recovery and reduced pain while you are recovering from surgery in the hospital. Sometimes we have to remove whole of the colon along with the rectum. This we do in patients who have multiple polyps in the colon, or there is inflammatory bowel disease involving whole of the colon. Some of the patients will also present with obstruction. These patients we make a temporary stoma and then give the multimodal treatment which we earlier discussed, including radiation and chemotherapy, then operate and then close the stoma. Some patients present with advanced rectal cancer where the cancer has already spread to liver, lung and peritoneum. Now if this spread is limited to few spots in liver, lung and peritoneum, we can plan a curative treatment. For this, while operating, we remove those spots as well. But before doing any surgery, we again go to multimodal treatment. We'll give chemotherapy or immunotherapy, and then we will plan the surgery. Radiation will also be included in the treatment plan. For liver lesions, sometimes we use RFA, microwave and radiation. Some of the patients will present with very advanced disease where they'll have multiple spots in all these locations which cannot be removed surgically. We will treat those patients with chemotherapy, targeted treatment and immunotherapy. Most of our patients will also need radiotherapy, chemotherapy, targeted therapy or immunotherapy before and after surgery depending on the spread. Early detection saves lives. Stay alert, stay healthy.